3 or 4 years ago, the wisdom of a couple of wonderful board members of the American Academy of Nursing began to think about healthcare being around the corner. So Joanne Dish and Carlene Kerfoot said we need to really think about a holistic system that really addresses the issue that we all say we care about, which is patient-centered and family-centered care. And so they came up with the idea that we should look at those practical solutions, in our case nurse-led, but we're now moving on to interdisciplinary issues as well. But let's look at those people out there. And we were surprised to be able to find immediately evidence-based, research-based programs that have been delivering care in very different ways to address specific needs of people all over this country.
We know and understand that nurses are the largest single sector of the healthcare workforce, and that there are plenty of evidence, lots of studies, that show that patient care and safety, the quality of care and patient safety are directly linked to their presence and to their skills. Yet we also know that too often nurses' contributions aren't noticed, aren't credited, and aren't included in policy discussions where their voices, ideas, and experiences really ought to be heard. And that's why we chose to support the Raise the Voice campaign.
The Academy as a whole, of course, deserves an awful lot of praise for its leadership in bringing some of these key issues to the forefront of the national debate on healthcare reform through the Raise the Voice campaign. You would think that with virtually everybody in America focused on an issue, some in a positive way, some in a less than positive way, that it would be easy to get issues some attention. But that isn't the case, and Raise the Voice has been important for that by showcasing stories of nurses through the Edge Runners project and bringing new thinking to a range of the healthcare challenges.
She's such a champion of all of the things that we're talking about today in terms of how do you take people who really know the insides of healthcare systems like nurses do and to move great ideas forward, to work across many different kind of professionals and providers and settings to bring the best quality care to the folks who not only need it the most and who are supported by family caregivers doing the absolute best they can to help the folks stay at home, but also we know how it reduces costs over the long haul and brings better quality of care. And she's just such a champion of the Raising the Voice campaign and all the kinds of work that you're doing. And we're just so proud in Arkansas that we have an edge runner ourselves with Dr. Claudia Beverly with the Arkansas Aging Initiative. And so Senator Lincoln has been to the Reynolds Geriatric Center down at UAMS in Little Rock, and we've been through that facility and seen the wonderful things that Dr. Beverly has done.
What nurses do is just so keenly important to each and every one of us. And I want to thank you for what you do and your leadership, particularly in being supportive of healthcare reform. We're at an extraordinary moment in history, I hope, that we actually get this done. And having your support for healthcare reform, understanding that making sure that every American has access to health coverage and the health care they need, and the fact that we can do a better job in containing costs by improving the kind of care that people get is something you understand. It's something you do every day.
So I'm going to talk to you today about why it is that nurses are so important in this world. And I think the first message I want to say is that we focus on things that are of great significance to people, to families, and to communities. And our work has focused on the epidemic of chronic illness in this country and across the globe. Chronic illness consumes 75 cents of every dollar we spend in health care, and that proportion is growing every day. And the reality is that we have not placed enough attention on how to design a health care system that is upstream preventing chronic illness, and then when we get people living every day with multiple chronic conditions, figuring out how to address their needs so that the end response isn't, when I have a problem, I'll go to the emergency room and I'll go to the hospital. These individuals are not well served at all in that environment. In fact, every time they go to the hospital, it creates conditions for readmission that we've learned about a great deal in our work. So our work on transitional care has been to really interrupt the pattern and trajectory of chronic illness for vulnerable older adults.
Why, at the age of 4, could you envision the poor outcomes this child is going to experience as a child in school, that his or her lives may be less successful than other children's? Because somewhere in those beginning formative years, even when that child was in the womb, and I know all of us are women here, so not all of us are women, but I want to convince the gentlemen too, it's really important to start prenatally. So in 2001, on behalf of 4 nurse-managed centers in Philadelphia, I wrote for the Nurse Family Partnership Program to begin in 2001 in Philadelphia. Today, as we were then, we are the largest nurse family partnership in Pennsylvania. However, Pennsylvania is a statewide initiative and is in 40 counties now. We've served over 12,000 families across more than almost 13,000 families now in Pennsylvania. And in Philadelphia, we're close to 2,000 families. So it's not just reformation or reforming health insurance. It's us as nurses, as women, as leaders, going out to engage in conversations, as close as intimate as on an elevator, and as far distance as your email or YouTube or Facebook, to be able to convince others not only to go into a nurse family partnership program, but be able to say that there are many other interventions or prevention services that nurses can render. We can be creative and we can be opportunistic.
And we wish you well with raising the voice. We'll raise a voice with you anytime you want. The nurses, midwives of the United Kingdom are with you, and the people of the United Kingdom are with you.